All right. Welcome so much to today. I'm excited to kind of dive into this conversation that I've been having for about 3 years. And I'm just so excited to learn about what other people are seeing in our communities, because there's a lot to tackle when we're talking about the experience of patients and caregivers in our healthcare system. But the whole goal is to really start a conversation and also introduce things that I'm learning in the policy and the changing structure around our health data in our country, that I hope we can just strike up a conversation, an honest conversation about what we're seeing and the application of that in order to help more families that I know a lot of the folks on this call and that might be watching are interested in solving. So I will just go to this next screen, but I am just curious for people to introduce themselves and kind of say who you are, what role or organization you're kind of playing in your community, and what brought you today. Kim, would you be interested in starting us off?
Absolutely. Thank you so much, Jean. I'm Kim Williams, and I am here representing the Indiana Parkinson Foundation. And our organization exists to come alongside those with Parkinson's and their families, provide them with valuable programs and services to improve their lives, whether that be physically, mentally, or spiritually. We want to walk hand in hand with them and give them the resources they need to live a better quality life with Parkinson's disease. And so what brought me here today was just all that I hear from the people we serve and their needs. And through conversations with Jean and hearing all of the things that she's doing through Jesse and other mutual connections that we have, I just wanted to learn more about how we can be boots on the ground and helping making these types of things come to fruition to make lives better and easier on the people with the diagnosis and also their families.
Awesome. Well, thanks for that. All right, Quentin.
Yeah, I'm Quentin. I work for an Indiana-based health tech company called Welly, and we're building an all-inclusive patient platform, and part of that is accessing medical records. So really interested in learning your insights there, Jean. And also what brought me here today is I do have grandparents who are aging, like getting into their 80s. And I think that primary record is going to do an amazing job helping to simplify that, replacing the binder. So here to support and learn. Yeah.
Well, thank you so much for that. I really appreciate it, Quentin. And Chris? Is Chris there?
Yeah, I'm here. Sorry, I had to get off mute. It took me a couple of clicks. Chris Ross, emergency doc by trade. So I see all the problems here. See Parkinson's patients in the ED, patients in extremis, patients in the worst day of their life, and trying to use what information is available to me to help make the most educated decision on those patients kind of in, those situations. So super excited. I'm the physician advisor for primary records, super excited to kind of push this platform more to patients' hands so that I can help take care of them better in the emergency department.
Awesome. Thank you, everybody, for introducing. I really appreciate that, because I think the different perspectives is always helpful. So kind of moving forward, the first question there'll be a lot of question, and then there'll be a lot of just kind of talking through of sharing what we're seeing and learning to help, kind of who the people that you're trying to help. But when I think about patient journeys from the moment of whatever life-altering diagnosis that they get, or maybe it's, a traumatic event that then suddenly puts them in regular interaction with our healthcare system, and then this sudden need that I've heard from them many times of trying to make sure they get their medical records. And I've had some interesting conversations with folks in the higher levels of this industry. And I get this a lot of like, well, why should patients and caregivers even have their medical history and records, right? There's the health information system. Like, they don't understand how a family is using that in their home to help them. I just didn't know if there's any insights, from the three of you that you can kind of, and I'm happy to also interject the things that I've learned, but how do families and patients use their medical data to support their care at home? What kind of things have you heard or seen in the people that you serve or take care of, family wise?
From my perspective, I know that a lot of times when there's care going on in the homes, there are a lot of different people in the kitchen, if you will. And so, if somebody's taking care of mom on a daily basis and knows everything by heart, it's one thing. But when you have a team of people helping with mom, having those, pieces of information that share about, hey, they're on this medication and hey, it needs to be at this time every time. And hey, make sure they're not eating protein around this time when they're taking that. That's all very intricate details that need to be communicated. So having, their medical history and knowing not only about, their history, but what medications they're taking now, who their doctor is now, who their doctors are now. I think that's very important to the day-to-day care of people, in their home or in an assisted living facility, so on and so forth.
Awesome. Quentin or Chris, do you guys have any stories?
I definitely do. I probably saw my laughing reaction to this. I'm coming in blind. I know I'm a primary record plant, I guess, to this call, but I'm coming in blind to Gene's presentation. I haven't seen it, but like the thought that, and we have this a lot. So I see kind of two groups of patients. I see a lot of patients that, are, first get that diagnosis. That's a critical diagnosis, or first in extremis, have first big issue. And they don't know that they have to organize their information. And I have another group of patients that has been through it, kind of like the Parkinson's families, like you discussed, Kim, that have been through this a billion times over and know that back end communication between doctors, between hospital systems that they're expecting just does not happen. It just doesn't happen. It's on the patients and the patients' families and caregivers to advocate for themselves in those situations. So I totally hear the same thing, and classically, this whole problem has been put on the healthcare system to solve, but clearly it's not doing the job as it should be. And so, yeah, I think I just thought it was funny when you said that people higher up expect that it's supposed to be communicated between hospital systems, but it definitely isn't.
Mm-hmm.
Yeah, and I'll add to that. I think that medical history and knowing or having your medical history close at hand becomes incredibly important, especially with times of crisis. And to prepare best for that, you need it all collected and get ready for it. So I think that's incredibly important.
No, and it's the stories that we have heard, or even I've heard as a nurse, like I think the thing for me is when you don't have that information, what I've learned in the healthcare system, sometimes it's just easy to repeat things, to quickly get that lab, to quickly get that test result, rather than have to call somebody and try to get the information. And so when I was playing this role of kind of that advocate and care coordinator in my community, I just couldn't get over how many times I had these moments where a piece of data or information was needed to make a plan to help someone at home, and we didn't have it. So then we had to repeat. We had to make another visit, more time off needed from work. So like the thing that I have found is, and what we kind of really just trying to figure out how to do for families is, how do you attach that to the person? So in that moment, when decisions are trying to be made and we're trying to get clarity on what to do, that families have that and the doctors have that at their fingertips. So, in this next part, what I wanted to kind of just all put us in this mind of, and I deal a lot with the aging, but what we also learned is there's definitely families that have suddenly children that have rare genetic conditions that pop out of nowhere. And they're very similar stories. It's just different family members. But whatever story you have in your mind, maybe it's, oh my gosh, the worry of my dad having dementia has finally hit, and I'm getting the calls because he or she cannot, take on their care. Let's just walk through what it would be like for that daughter to get caught up to speed today. And so what I did is I took 4 random hospital sites, and I took the names out because this isn't anybody's fault. Everybody's just trying to do the best they can. But I just want to show you what it looks like from that family and that caregiver's perspective when they try to go find information, what they have to do. So in this first one, I was Googling medical records, and I would enter a large health system, in our country. And then I'm screenshotting, and what I'm highlighting is the things that the family, so think about a family in crisis. There's a lot going on and they're trying to figure out, and they're seeing things like 3-step process, 5 business days. Oh, your doctor's not requesting this, you are, there's going to be money. So I was like, okay, well, that's a little discouraging. Let's go to the next one. Same kind of thing, make a request. Oh, we have an EHR for our health system, right? So even though I might be taking my parent to multiple, it's not going to help me if it's not in their system. And again, there's money, and it is nominal fees, and HIPAA has protected that a lot. But it's hard to read as a daughter that's trying to kind of come up to speed. Same kind of thing. Signed authorization. A lot of daughters and sons that are trying to help parents, I know, who's authorized? What do I need? Oh my gosh, now I need a POA, and now that's more steps I need to do. Again, fee for patients. And then my favorite is call during daytime hours. You know that most of our caregivers are working, and the struggle of that. And then the last one, allow up to 30 days. So now there's not even a consistency of how quickly can I get my records or information. $45, which is a larger one. And I think it's because it's dealing with medical imaging. Usually fees are somewhere less than 25, I've seen. And then again, that submit release of information. So in my head, when I'm reading this in a moment, and as a person that's trying to figure things out for another person, all I see are barriers, right? Barriers to try to, with the intention of helping someone else. And so I have talked to some very savvy caregivers, and I am just curious to hear if you guys have seen workarounds or things that families are doing to try to deal with these barriers, or if they overcome the barriers, how they're trying to organize or collect things. Any things that you guys have seen or heard, other families talk about on getting through some of this to get information that they need?
Well, I don't know if this is necessarily a workaround, but something that has been developed for the Parkinson's community is an aware and care kit, which helps them to kind of carry around their medical records on a day-to-day basis. But again, it's not like attached to your body. So if you're in the wrong car, or you didn't bring it in with you, or you're not the person that holds it, it may not even be with you. But that's something that I see a lot of people with Parkinson's utilize if they're, wanting to have their medical records when they go to appointments, this, that, and the other. I've also heard about caregivers, one of their workarounds on, like, if they're in a facility where their loved one is living and they're not, getting their medications on time, or they're, in a situation where they're in the hospital and they're not getting their medications on time, the caregiver, they're like, I've got the pills in my bag, and I'm just, it's like, but they feel like they have to take it into their own hands because there's that, struggle. So that's just some things that popped into my head when you said workarounds.
No, those are great stories. Chris, have you seen what are people doing to help relay their story to you in the ER?
So I've seen, just my last shift, I worked 3 or 4 days ago. And I have 3 different patients that just popped straight to my head about the workarounds. One was a lady who had all of her medical problems and notes from what was going wrong with her on like a to-do Google Docs thing on her phone. She also wanted a copy of a piece of medical information that I had. And so I had to print out a copy of that for her to take home. So she had both some Google thing on her phone and then a printout copy of something else that I handed her. So she could take it home to her nurse, her daughter, who's a nurse, that I talked to on the phone to try and help relay the information. So we got all that. The nurse can't see any of that. It's all on mom's phone. And then she's taking home a piece of paper too. Another one was a lady who didn't know what medical problems she had. She knew she was out of her medications, and she knew her blood pressure was high. She had her medication bottles and crumpled up pieces of cardboard that were from where her previous packaging of her medications. And that was her way to communicate to me the medical problems she had and what she might need refills of, despite her having a primary doctor in a different system that I couldn't get the information for. So I used those pieces of information to try to refill her medication so she didn't run shallow. And one of them was seizure medication that obviously she needed. If she didn't, she was going to have a seizure. The third one was another patient that had a significant cardiac history that came to see me. Chest pain, kind of worrisome story. He had nothing at all. He was from a different hospital system. I couldn't get access to any of his information previously outside of like a couple Word document type pieces that told me what his EKG might look like. He supposedly had full workups before, and I had no history of that. So me and him both kind of flew blind for that. So those are 3 patients. I saw probably like 20 patients my last shift. That's 3 of them that just kind of popped up. So this is definitely an everyday occurrence for me.
That's incredible. I sit on, there's a wonderful group called Open Notes, and they, one of the workarounds that we hear a lot, and is the caregiver pretending to log in as the person they're caring for into their patient portal, which gets really confusing, especially when they're starting to try to use the messaging and whatnot. And there's even like an analysis of like all the messages, because sometimes they would forget to, change it to pretend to be their parent. And they would be like, my dad, even though it's, their dad that's supposedly in their patient portal. So, and so it's, and while it's, and it was funny because this group, they get a lot of pushback, but when you go through to try to figure out, well, how do you get what's called proxy access or shared access to someone you're taking care of in the patient portal? It's even worse than the screenshots I showed you guys as far as the 4, as far as the steps it takes. Actually, Chris and I recorded one where we try to do with our local healthcare system. We're a nurse and a doctor, and I was like, let's share portals. And it took us 7 minutes and 23 seconds to figure out, oh, we have to actually go to our primary care office to request this. Like, it's just not easy for families that are trying to take care of each other and the people they trust to kind of invite in. So, so the workaround, a lot of people just say, screw it. I know my dad's social security number. I know all of his answers to security things. I'm just going to create his portal and I'm going to pretend like I'm that person. And I don't fault families for doing that. But this is what they're forced to do because we're not making it easy, on them and all of those barriers. But Quentin, anything else that kind of came to mind as we're all sharing?
No, that's great points. I was just going to ask, do all EHRs even provide access for proxy logins? I mean, that might be a subset, right?
Correct. Yeah, no, because the ones that they're even looking at were more of the bigger name ones that have most of the market. Yeah. So yes, and some of the smaller ones that I have seen, it's there is no option for a shared or proxy access. So that's an excellent point to also bring up.
You didn't share the follow-up, Gene, either, of when we actually made it to the doctor and then asked them about getting proxy access.
No, I know. So we are who we are. They don't know who we are. So I'm not faulting them for not knowing, but I said, so I'd like access to my husband's, patient portal. And they looked at us like we had 4 different heads and they said, well, that's usually like a parent-child thing. And so it made me feel very shameful. And I'm like, well, we want to share in case something happens. This is where my data is. And they just kind of looked at me and we're going to move forward on trying to help us. So then I asked, what would I do if it was like my dad and he had Alzheimer's? And they said, oh, you just log in as him.
They were very nice. They were very kind. They were super helpful trying to get it figured out, but clearly it's not something that they were made aware of, despite the website saying that's what we had to do.
Right. And because the large health system says, oh, just go to your primary care office, and the poor, overburdened primary care isn't ready to take on these requests. But we did push a little bit farther, and they're like, well, let's just see. I know how to do it for a parent and a child, so let's see if we can do it as a husband and wife. And they did find out that there is a box they can check to allow me to have access. And then I, of course, forgot to ask if Chris could have access. So now we have to wait till we go back to the office again so he can share. So it's just, this is what it's like today. Like, that's really the encapsulation. But the next slide, Kim, it's really just hitting home what we found. So we have done research with families and talked to hundreds of families. And what we always talk about, the solution that we're trying to do at Primary Record is we're trying to solve for that medical binder. Because what we find is That seems to be the biggest tool, or as Chris talked about in his thing, it's piecemealed together, between sticky notes and paper documents and notes on your phone. And so we're at this early phase to try to figure out, is there a way to have families have one place to kind of simplify, what they're trying to do in their own kind of created systems. And Kim can probably tell many stories. What really happens is when you're the owner of that binder, then you become the bottleneck of care, because it's your system, it's your notes, it's your filing system. So even handing off to someone takes time because they don't know your system. Or even in Chris's case, a binder is wonderful, when patients bring in the ER, but he has, I don't know how much time per patient, Chris, like he doesn't always have the time to rifle through the whole story.
Probably a couple minutes.
And so this is where, we talk to just tons of families to kind of understand, and we just got a sense of how overwhelming it is for everybody. But that then gives me hope to talk about what I'm about to talk about today. So as we were in this conversation, trying to understand how to make this better for families, in the background, there was a law passed in 2016 called the 21st Century Cures Act. And there is a lot in this law. But there are three things that I want to draw attention to that really give me hope of how we can change this experience for patients and caregivers. The first thing that I had to learn, and what I want to share with just kind of our community, is these electronic health record systems, they just proliferated. Money was poured in for all of us to be on electronic systems in healthcare, but there was no standards put in place. As far as how those were structured. So when systems try to go talk to each other, they could not, because this system over here calls it tobacco status. This one calls it smoking status. So when you try to share, it's not lining up. And so they can't share information. So the big bulk of what's been happening the past, 7 years since this has passed, is that these vendors, or the electronic health record vendors, are now required to be certified, and their systems have to be speaking the same language, so that what we call in the technology world of our medical data that's electronic is, all of that is endpoints, and so when you go to try to share, those endpoints need to connect and be shareable. So that is starting to come. And it's there's been deadline after deadline. COVID definitely helped extend it because the healthcare system was not ready or able to, to change things. The next piece that really became instrumental for opportunities for innovation is the second bullet point. So what's been really cool about this 21st Century Cures Act is, as you saw in all the HIPAA things, like provider to provider is a very accepted form of why you need medical data, right? But you saw that when a patient wants their own records, there was a cost. So what this legislation did, it said, okay, we want patient access to be a priority in this system. So if a patient wants their medical data electronically, then there is a means to do that. And there is now, and I'll share later, they've then made it allowable for a patient to choose their mobile application that they trust to be able to take this data from the different systems and store it for themselves. And that's really, that line is what then spurred primary record and learning and figuring out how to become that trusted platform for families to store this. And then lastly, none of this works unless there's an incentive. If anyone is, and I'm sure many of our community partners know healthcare very well, it's a very much, we try to do carrots, but it's mostly sticks in healthcare to try to get people to change behaviors and share. And so in order to make information available, they also put in what's called an information blocking. And I'm going to walk through today too to show our community partners that we need to be filing information blocking claims so that we can change and push people. That is now in effect for certain types of folks that have health information, and I'll share that when we talk about information blocking, but that just went into effect September 1st of 2023. It carries a $1 million penalty when an organization is found that they are blocking information. And that's what's really is needed in order to spur change and make an option to have patients and families be engaged with their medical data and have that future. Like I say, it's the dream, this future where data flows freely and securely between the people that need it, right? Because what's the end goal? We just want care to be coordinated. We want to improve our health outcomes, and we don't want things to be expensive anymore in healthcare. And I some days read this quote a lot because any change in healthcare is an uphill battle. But that's why I'm excited here to talk, because I do want to share the reality today, even with all of this legislation and trying to get, more of the systems talking to each other, is that even if you're going to between two different places that use two different electronic health records, our success rate of transferring your data is 22%. And so that's what Chris, I always ask him, I'm like, are you still seeing binders in the ER? He's like, yeah. So until we don't see binders anymore, we know that this isn't solved for patients and for families. And because the success rate of them showing up to a place, not knowing or anticipating if their data has followed them, is what's causing our families that need and that reason to have to collect their papers and make their notes in order to share their story. But is there anybody have questions on kind of any of that data or that research? I will say they did show like between two similar, like a MyChart or an Epic, the success rate does go up and it's around 67%. But most families we talk to, they just expect 100% of their data to follow. But any questions on that study or just anything that we've found so far? Okay. So I'm going to do a bunch of acronyms. Oh yeah, go ahead, Quentin.
Sorry, I was just going to add, such a low success rate, that also puts a lot of strain on the administrators in that healthcare setting or even clinicians, right?
Chris, you want to speak?
Like a lot of added work there.
Oh,
to get things to map.
It's like, well, and the deal. So you said you're from northeastern Indiana, right?
Yeah.
So there's a healthcare exchange through Indiana called HIPAA. It's one of the better healthcare exchanges in the country as far as statewide. But if you're in northeastern Indiana, they don't have a lot of coverage, so you might as well be on a different planet, right? So, and if I'm gonna get information, we're talking about maybe a fax, and that's only during business hours if that thing is available. And then you're talking about the workflow. Like I already said, probably 2 minutes to start with a discussion with the patient. That probably, if I did that myself, it probably takes at least 10 minutes of my time. And I don't have that. So then we're taking somebody else's time, a nurse or a tech that could be doing something else in patient care to try and pull this aside. So a lot of times, honestly, frankly, it just doesn't get done because we just fly blind and repeat studies like Gene said to try to come up with information because it's already so onerous or impossible because we get rejected then from the same process on the back end. So yeah, I appreciate you pointing that out because it's definitely what I'm living.
Mm-hmm.
Wow. Thanks, Chris.
Yeah. No, great question, Quentin. All right. So what does this future look like? So the legislation, the 21st Century Cures Act, spurred they call themselves the recognized coordinating entity. So there is a lot of smart people trying to figure out what does a national health information system look like. And how do we even go about making all of these systems talk to each other and all of the use cases, of what patients and all of the conversations I have, there is just it's a giant hairball they're trying to figure out. And in the end, one day, there will be a part of this whole flow of our health information is there will be something called individual access services. And that would be what primary record is striving to become. And what this is this idea of it is there are groups that have applied and are going through the rigmarole of being appointed and they're going to be called Qualified Health Integrated Networks. So how to pronounce that acronym is up in the air in the healthcare field. I've heard QHIN and I've heard all kinds of other of terms about it, but that is the future. And it's a lot like our state health information type networks, but they're just trying to make it, because we're changing as a society. We move across the country more, right? Like, so this whole regional based health information networks are not meeting the demands of, our patients and our caregivers and our providers. So So this is the future. And then the idea is that as an individual access service, then we have to figure out how to securely and help, we represent patients and caregivers on taking advantage of this new information network system. And so there'll be a whole set of things that we need to do to become a part of that. The good thing is there's kind of a gateway open now for us to kind of learn and take advantage of that. So I'll share more of like what we're doing today, but that is the future of what all of this legislation has spurred. If you ever want to follow this, you can get really in the weeds, but the website down there, RCE at sequoiaproject.org, has it's a public contract. So everything is recorded and accessible to learn more about that conversation. And it's interesting because it is so provider focused right now. And I always had so much hope hopping on as a representative of caregivers and patients. And it's just losing sight because there's so much happening. So, we're kind of honored at Primary Record to kind of figure this out for families as things are panning out on a higher level. And then the thing, what I hear about, and the thing that I think community partners need to really, what I would love to partner with and hear feedback and help you be educators out in your community is there's a change, right? So if I mention health data, the next question I always get is like, oh, is it HIPAA secure? And so let me just kind of explain and hopefully then we're going to evolve and really define this. So HIPAA, what I always have to explain to families and caregivers and patients is HIPAA is meant to protect you, that you go into an office, data is collected about you, you leave that office. HIPAA is in place so that when you leave that office, your data just doesn't go all over the place. HIPAA is trying to protect you as an individual or your family member, that your data, you control how your data is shared. And most of us sign waivers and, and there's a whole regulation from provider to provider how that works. When it comes to consumer applications, so when this ONC in the 21st century, so ONC is the Office of the National Coordinator, and then you have the 21st Century Cures Act, what they are trying to do in empowering families and patients to, be empowered with their own data and putting it into an application. Now it's back into the hands of the consumer, quote unquote. And so HIPAA is no longer applied. And so that's a big, designation. So what does that mean? So it means that there's another whole entity in our government that will be monitoring health data. And what we're learning at Primary Record is that it's the Federal Trade Commission. And they actually this is the thing that we constantly check to figure out the security and privacy. So we build our app just like HIPAA, but we cannot call ourselves HIPAA secure. We do all the other things that is needed for security and privacy that fall under the Federal Trade Commission Act there. And then the piece that the other folks that what we hear a lot is and that can be a big piece of education, is making sure people realize their rights to their electronic data. So the cool thing when we first started our learnings is when I went to go access my electronic data using the Cures Act, what I got back was everything out of that electronic health record, right? So what the Cures Act has said is, I can go in and my patient portal may not show me everything. I don't know how many of you looked at your patient portal to try to find history or what was that med they gave when I was inpatient. It's not there. It's really hard to find, and all patient portals are kind of different. But what we've done at Primary Record is to understand through this patient access law now, through the Cures Act, you have a right to this electronic data. And what are, how can you go about to get that for your family and organize it? So those are the learnings we're learning. And then, with community partners, I think the first big hurdle for us is making sure people have patient portals, because you can't get electronic data unless you do the system wherever you're getting care, the patient portal. You still need to log in and do those pieces. But once you have that in place, then you can use a tool and the full 21st Century Cures Act to really take advantage for your family to kind of start owning and collecting your own data. Any questions there? Because I know there's sometimes a lot of questions when it comes to HIPAA. All right. So I'm going to pause. I think I can pause. So the information blocking claim is super fascinating. So like, in being a new application, I'm learning a lot, and you test things and you see how well they go off with people. Well, our government is doing the same thing. So they have the information blocking claim portal, and it's not getting many hits. My theory is because not many people in healthcare know that they can even do this. But what the information blocking claim is saying is, let's say you are trying to access and you get denied access, like, oh, we're not going to give you that data, that medical data. Well, now we have a tool on a site, and that QR code would take you to this screen, and I'll kind of walk you through what the information blocking claim portal looks like. So that link leads to, the kind of the FAQ, and then there's a link that says report information blocking claim. And you just keep clicking on until you're in the report information blocking claim system. And there's a lot of different education pieces, but it's very basic. You can do it anonymously, or you can do it with your own name, but it's literally just, what is your experience? And so what this is trying to accomplish is trying to get feedback about the new legislation, if it's working or not. And it's been a struggle. They get mostly from, I think a lot of lawyers have been submitting this when they're trying to, help patients with certain cases. They do have some patients, but they're slowly getting more claims, but not as many. But now that it's September 1st, 2023, all of the claims that are being put in here now have a potential for going, if they are found valid, then they would go back to the health information network that's charged, or the vendor, or the electronic health record vendor. And they now get to say, like, we have found you are information blocking. Like, that is a $1 million penalty. So there's a lot to learn there, and the folks that I have that are in Washington, D.C., it's pretty fascinating to watch and listen to them trying to figure this out too. But like anything that's new, hearing feedback from the people that it's affecting is super paramount. But happy if anyone's got any questions on information blocking. All right, bye, Kim.
Bye. Thank you. I'm sorry I have to hop off early.
No, thank you for coming. I appreciate it.
Okay. Bye, guys.
All right. And then the other thing to kind of educate, what we realize is, what are going to be the right questions to ask, and how do we educate, people that are already overwhelmed by healthcare? And now, while it's wonderful to hear this opportunity to be able to, bring all your information together, there's a lot of people doing this. Who can you trust and who can you not? And so this was kind of some questions that, at Primary Record, what is our benchmarks? Because our goal is to kind of be that most referred service and trusted service of families and caregivers. And so these are kind of the standards we're putting around on, that and what we want to educate people. So I imagine there'll be a future webinar just on this, because this has been super helpful to kind of dive in. But any initial questions when you're talking about asking the right questions, and scanning this very wordy slide?
I think the funded piece is, it's not a question, but I guess a point. The funded piece is kind of something that's come a lot more in vogue and news with other applications and things like that. So I think hopefully consumers are becoming a little bit more aware of where their data is going and how it's being sold, like with Facebook and Twitter, et cetera. Healthcare data is like super sensitive, right? So if you're in situations where you're maybe logging into an application and you're offering up access to your health information, you're getting access to your health information, it's super important to know where that information is going, especially how that application is being funded to be able to pull that information, because all of that's a cost. Mm-hmm. But like for a lot of those, like they're behind insurance, different like funding sources. So I think it's really important that you dig into the company if you're going to help share that information to find out where it's going to be going.
No, I sit on a patient family advisory council for a large health network, and we were reviewing actually one of these apps, and I just love this gentleman was in his 70s, and he asked the presenter, he goes, "So if I'm not your customer, who is?" Because, she was touting, is it a free service for him and all of this. And I was doing the slow clap, because like that was just super awesome for him to even ask that, because we do assume in healthcare, I think there is a sense of free. and you know, and that pause when it comes to especially your family's health data, like that responsibility is, you know, huge, and trying, and when you're taking care of somebody else, you know, having that right question. So great point, Chris. All right. All right. Well, I am at the final part of, you know, kind of what are we doing at Primary Record with all of this new legislation, and you know, this opportunities, because we know the problem and we know it's not going away, and it's actually becoming more burdensome our healthcare system, because we just have a growing population that's getting older. So even if you've taken wonderful care of yourself, you're still going to be living in an 88-year-old body, and you're still going to be engaging in healthcare, and your kids are going to start worrying. You know, there's a lot more people about to start using healthcare services. And that's kind of where we really, when we sat around the table and try to figure out what is the problem, that binder, well, what is the value of solving that? And what we came to is kind of what everybody was talking about in terms of, you know, why have your data on hand? What we have found, and there's tons of research out there, is that when you have someone that has cancer and they come prepared with their information, these are the better outcomes they experience. You know, when you have this person you're taking care of with Alzheimer's, when they have the information organized, they have this experience versus someone else. So we're just excited to really tackle, and what we found instrumental in our approach is it is the family. There is some defined family, and it can be legal family, or it can be kind of a self-defined family. It's a very loose but secure way we've done in Primary Record. But that has been the piece for us, because it's usually that primary organizer or person in the family that's making sure everyone else is taken care of, so they get the care that's centered around them. And so that's where our approach is very family oriented, and you know, where the person's at the center. So I'm going to end this, and then I will flip over just to a quick tutorial to walk through what we're building, and then fire questions at me. And if you have one while I'm getting this up, Miguel, I see you on the call. So wonderful to see you.
Hey, good to see you. Sorry, I came in a little late.
Nope, I love that you're here. So Miguel, you want to introduce who are you, what role and or organization do you represent, and what brought you today?
Well, my name is Miguel. I've been a nurse for about 9 years, and I've done 7 years of traveling. My organization name is Nurse Pulses, and I'm pretty much basically just a nurse consultant. Is my approach of getting out into the world and helping people in the community.
Awesome. Well, thank you for sharing that. All right, so let me see. Going to start.
So Miguel, do you take on individual clients and help them organize information, or what is your role with those patients?
It is that is my approach to engaging people in the community. It's going to be to be that resource, that hub, or some sort of hub for people to reach out to think of. I want people essentially to think of me as that first, like, hey, I have a question about health. Let me call Miguel and see how he can help me, or where he can direct me. That's the intent. That's the basis of it, the foundation of it. Obviously, when you start diving into what kind of health, you know, if it's just for example, just Primary Record, you know, is it a resource to kind of consolidate all my health history or in one place, or is it do I need a resource in the community? Like, hey, my mom needs health caregiver at home, you know, let me call Miguel and see who he knows, or any pretty much I'm trying to be it all is what I'm trying to do.
That's so awesome, Miguel. Yeah.
You're like the substitute nurse family member for whenever they don't have a nurse family member, sort of thing.
Exactly.
Yeah, you know, and working at the bedside, you know, people have always made the comments like, man, I wish I could take you home with me. It's like, well, let's see if we can, you know, let's see if we can meet in the community.
100%. It's great. It's definitely, I mean, it's totally needed. I see people, I'm an ER doc, so I see people all the time that need those resources and look out for it, but it's just not available. So that's awesome of you to do.
I know, that's what I cannot one day, Miguel, to like work with you, because I think like we're very focused on the family, but I think there's all kinds of different disruptions in the care model of how, because if you can disrupt this whole information flow, you can give people better care or have those touch points.
Yeah,
But
the factors of where things can go wrong are many, right? As we all know, it's like it's there, but we can make some progress.
yeah, most definitely. So, well, I'll just do a quick workaround, and I apologize. I have my dogs on here because they're medically complex, but we are not connected to vets right now. But you're welcome. There's kind of two flows of primary record. There's a very integrated flow as well as a manual flow. So for them, I just use all the manual flow. I'm uploading their immunization records. I'm putting in their visits and whatnot, which you can do, especially if you find a healthcare system that is still on paper, which they do exist. But just kind of walking through my own personal records, the thing that we learned at Primary Record really quick was that families don't want to manually input all this stuff. And even when I was running, Miguel, kind of a service like you were talking about, I would spend 10 to 20 hours trying to accumulate, the information in one spot, uploading into documents. But then the moment it's in a written form, it can be easily outdated, right? Because our health is always changing. And so at Primary Record, what became super instrumental is that we need to connect to the systems. And so all that we are talking about with the information blocking and the patient access, like this is why this is possible today. And it's super cool to see as a nurse. But I can connect to the portals. And here in Indiana, I think we have pretty much all of the major electronic health vendors in one spot. I think we have Athena Health, we have Epic, we have Cerner, now Oracle. So it's you jump around finding the best doctor, then lands you with your information in a million places. So the key is to get the data there. And then what we learned we can do is we take it, and Chris and I, because we're a nurse and a doctor, we were able to guide the engineers to figure out how to organize it in someone's primary record. And that came from talking to families too, how they don't want all the data that's in those electronic health records, but they want things that impact how they get care and share their story to others to get care from their home. So in the case of, medications, just to kind of walk you through, the coolest part is I'll just even go through, this is where suddenly I saw all of the drugs I got during my delivery. I've never knew what drugs they gave me. But now with patient access, I was able to import and see. So if someone's, what I learned really quickly, I would have told you I never take Ambien. What's the Ambien? What's the generic version? I'm blanking now. Thank you. So that was eye-opening to me, because I remember being really groggy one night in postpartum. I thought I had asked for pain medicine, but I think the nurse didn't want me to hit the call light during my postpartum new mom days. But just the ability to search and see that, as you can see when I pull this over, it tells me what healthcare system it came from. It tells me, what was the order, what date. And so it's been interesting to kind of piece that together. What's cool with primary record, what we learned is, patients don't want just a data dump. There are apps that do this where they, just give you all the data. What I learned is that, families, why they have those binders is they're adding information on top of that. Like, I want to link it to the doctor this was associated, or the nurse just gave me awesome notes about how I should take this medicine. Let me add a note to make sure I capture that. So that is in I'm aware and can remember about that. And why do I take this medicine, right? We import all of your conditions, and you can then just link right in there to make it super easy to connect the data that makes it meaningful for you. And the reason for doing all of this, especially when you are someone that's in a family trying to take care and multiple people or that care team is involved, is we then put in the family's ability in their hand to determine who they share with. So you remember all of those steps or whatnot. So when I want to share, I can just say, if I'm inviting, let's say this is my child and I've got a babysitter coming and I have a child with a lot of different conditions or on medications, I can invite them there on that spot in that day, and then they have it. So if there's an emergency, I know they have the information to be able to. And what's even cooler, which I will give a shout out to Alex, our engineer, who's incredible. We are giving and looking at the granular level of data that we want to share, and how do we want to share it. I just want the babysitter to look. I don't want him or her to edit things. Or let's say in the case of, getting help as a working daughter who's, I've got a caregiver taking my dad to an appointment, or using Miguel's services to help me out with my dad. Then I can let Miguel help me keep my record updated, and he can take my dad and he can add those notes or help me, explain things to me. And the beauty of all of this is I could invite siblings around that parent or other people to keep everybody on the same page. And what I got really excited about too is its transparency in our app is very crucial. Oftentimes when I was doing my care coordination piece, I would take care of two, older adults in the same place. And so that ability to, quickly filter, here, I'll just do my dogs because that's a lot more fun. But to quickly filter and just look at two of the people that are in my primary record and kind of get quickly up to speed, like, oh, we just took Kevin to the vet. Oh, here's his updated immunizations, right? So how you can quickly keep other people updated about what's happening health-wise or what's changing. So, that's kind of what's the door of getting access to records. I don't know. I just don't think some of the folks understand the use of data for families. And so that's what we're excited to even have this door to get to use patient access in a very meaningful way for a lot of families that we're talking to. But I'll kind of stop there. And if there's any questions, I'm happy to answer, or things to poke around if you want to see more but about our approach. Chris, you look so confused.
No, I'm good. It's just bright out here, so I'm like kind of squinting a little bit.
Oh, it's awesome.
I just want to say this looks so beautifully designed. It's so accessible. It's very obvious how I would use this. I like that. It's
Yeah,
very patient-centered.
Oh, thank you for that, Quentin. Because in designing anything, like, you're your own worst critic.
Oh, yes.
So it's wonderful to hear that feedback. We have like a roadmap of 1,000 things we want to make better, but it's very important for us to be very user friendly.
Yeah.
I also appreciate that, as like we've said previously, how I don't get access to all the information, and how the Fort Wayne area is an abyss of information for me. But patients, because of the Cures Act, get their information on their phone. So a lot of times I'll have patients pull up their information on their smartphone from other hospitals that I know I won't get information. And whenever I have to wade through that on the smartphone in the app, I realize that, these EMRs aren't necessarily made for patients so much as they're made for doctors and nurses and hospital systems. They just have to have this so that they satisfy a requirement. Like, there's not a lot of awesome UI experience through those sort of things. Because again, they're not selling to patients, right? Where does the money come from? The money comes from the hospitals and healthcare systems that buy those EMRs. So it's definitely an afterthought. But so I end up wading through a lot of those on patients' phones just because I can't get the information. I'm like, hey, can you pull up your portal so I can see what that X-ray actually showed? And one other thing, this is totally aside, but you had in there that you can get a CD. It takes like 3 days. Most emergency departments no longer have CD drives, and neither the radiology things. So you actually just end up repeating the picture because we don't have the ability to upload a CD anymore. So just another piece of something. Went through that not too long ago.
Oh, thanks for sharing that.
Yeah.
I might have missed this here. You're talking about the data points and so many data points that the software has. How do you do the transition into communicating all those data points to a client or to a patient and say, hey, this is going to help you make a better decision? Your decisions will improve because you have all the information. It's all relevant.
Go ahead, Chris.
I'm talking too much. This is
Jane's
presentation.
No.
But I'm excited about this because so we're going to create the reports to make it so there's a lot of different data points, like you said. And in those EMRs, there's a lot of different data points when I'm sorting through it by phone, or if I'm in my native Epic portal, which is what I mainly use for. And it's hard for me to digest that information, right? But there's smart ways that we can digest it for patients and for providers that are, or they're part of their care team, using summarized reports. So we actually have kind of created beta summarized reports of things specifically. I'm an ER guy, but I interact with a lot of other specialties, but for an ER visit. So say you come to the emergency department, I have a set number of things that I need to know, and I need to know those in less than 2 minutes. So we can make, based on all of the data that we have, a 2-pager front and back saying all the things that I need to know right off the bat. And then if you need more robust detail, you can, wade through that through an app or through a web-based platform or what have you. But I think that's how you can show value to families, be like, oh, I have all this information, but when I go to see my provider, they want to know this 2-pager. So here, I'll print this off, or I'll email a PDF to them, or fax a PDF to them with that 2-pager to be able to display and relay that information back to them, as opposed to another data dump, which is the majority of the EMR stuff.
Okay.
Yeah, Chris is excited for us to get started so that he can start geeking out on those reports. But
super excited about that.
I'm like, let's first prove the value that families will even want to put stuff in here.
That's what I want, because that's what I want to see, right? So it's selfish, but I think that would be super helpful.
No,
what is it that you wouldn't want to see as a physician, as a doc? Like, what do you not want to see? It's like, hey, don't take my time with this information.
The majority of it. I mean, like if you look at, I'd be being frank, right? So if I have 2 minutes to spend with you, how can I get the best use out of that 2 minutes? I always need to know your medications. I always need to know what kind of medical problems you are. It's nice to know where your doctors are, so I can kind of affiliate that with, can I get more information if I need to, or do I need to go through a different service? There's a couple different labs that are really key that kind of tell me quickly, like what I would be working with in certain situations that I could do. But a lot of this stuff, like your dermatology visit from 3 years ago, doesn't really matter if you're having a heart attack, right? Like if you're dead in front of me, I don't need to know about your endocrinology visit 17 years ago. Like I need to know these key things digested quickly in a short amount of information Now I may have to dig in more robust information if it gets more complicated, but up front, there's definitely a set of things that I need to know. And it's hard for me personally to wade through that in a native EMR system. Like there's every PT note, every message you send by my chart gets a separate category. It's a separate line. So there's some patients I can't even wade past the last month in one screen on the number of different things that I could access.
Okay.
No, it's pretty awesome. Well, we are right at time, and I am a time stickler because people's time is valuable. So I just really, really appreciate everyone jumping on this first call. Miguel, I hopefully it told you we were recording when you hopped on. So we're going to be sharing this kind of with community partners and really just starting, Primary Record getting out there, and kind of the philosophy that we want to tackle. Like a big piece that we're taking on is we got to educate the community. We got to get patients and families thinking differently, that they can be a part of this, their care team. They can be engaged. There's nothing better when you go to your doctor's visits and can rattle off your conditions the way your doctor talks to them. And this is kind of like the tool to do it, right? Like it's what gets you a seat at the table, so to say. So I just want to end there, and our hope is to kind of put one of these on a month and start engaging with different community partners to understand, how do we support the work you're doing? The dream that you have, Miguel, I want to dream there with you. So we'll definitely be working to see how to support those efforts. And then Quentin, I want to keep in touch too of all the things that you guys are working on. So, all right. Thank you, everyone. Take care.
Thank you,
Bye.
both. See you.
Thank you. Bye-bye.
Bye.